afternoon to our panelists and to all of the participants. This is an excellent turnout. Right now we have 68 participants who have joined us, and we expect upwards of 111 over the next few minutes. You'll see others join the group. So this is one by a large margin, one of the largest Zoom sessions that I've participated in. My name is Dan Florzo, and it's my privilege to be moderator for this session. The title is Economic Recovery in the Year of COVID-19. So this is top of mind, and in fact, our timing couldn't be better. We're seeing in the last 48 hours and over the course of the next few weeks, a gradual and phased in reopening in many places. And because of its decentralized nature, in other words, these decisions and phases are being defined by states and provinces and territories, we're seeing quite a mosaic, quite a range of changes that are being brought forth. Because of the lag time, and we'll talk a bit about this throughout the session, the decisions we make today perhaps we won't get the feedback for another 14 days or so, maybe even 3 weeks. So where an action is taken and the feedback is received down the road, it makes for interesting times. And certainly we'll be carefully watching whether we've gone too far or not far enough in this undertaking. Now, the importance for the School of Public Policy, JSGS, is that we wanted to bring together a panel that could bring a presentation and a rich discourse and discussion from a number of perspectives. Because reopening an economy is more than a health issue. It's a business issue, it's an economic issue, it's a public policy issue. And where we can bring these variety of perspectives together, perhaps we'll get away from just a simple discourse of whether we should or shouldn't, but rather how and in what way, and what would be the best measure of moving forward. Some of the changes that have been made to date, the things that we've learned, are going to stick with us in perpetuity. In other ways, we might have a wish and a desire, and it may ring true that we return back to what was. So our hope collectively is that the panel, through your questions and discussions, will be able to get us to a place within the next hour and a half that we're talking about what might stay, what might change, what might return, and what that new normal might look like. So I'm looking forward to it. So my name, Dan Florzo, I'm executive in residence with Johnson Shoyama School of Public Policy. The school itself is a Provincial Center for the Advanced Study and Research in Public Policy Administration. We're a partnership between the University of Regina and the University of Saskatchewan. And obviously that's based on the spirit of cooperation and collaboration that defines Saskatchewan. Since our inception in 2007, we've swiftly become one of Canada's leading policy schools for educating graduate students and public servants interested in and devoted to advancing public value. At this time, I'd like to acknowledge that while today's event is online, it's taking place online, JSGS, our school, its physical home is located on Treaty 4 and Treaty 6 land. And this is the traditional homeland of the Métis. To help our event run smoothly, we ask all attendees to stay muted and turn off their videos during the presentation and the Q&A portion of our event. What I'm going to do is introduce our 3 panelists. Each speaker will have 15 minutes to present. Following the presentations, our panel will entertain questions. And the way we're going to do this with such a large audience is that if you'd like to ask a question, please use Zoom's chat function to send your question to Karen Jaster LaForge. So it's Karen Jaster LaForge. During the Q&A, I will then ask the questions to our panelists. So she'll send them to me. I will verbalize your questions. If you have any logistical questions during the presentations, please don't hesitate to send a message to Karen, who will be able to assist you. Please note that as with all our public lectures, this presentation is being recorded and will be available for viewing on the JSGS website at a later date. So, without further ado, our speakers, and we're really pleased to have these three with us. Joanne Hardy is president of WBM Technologies Incorporated. Joanne, who has joined us, has a career with WBM that has spanned over 2 decades, and she's worked across every aspect of the organization, all the way through and up to the most senior level. Because she works in the technology industry, it might be hard to imagine that some of her most valued skills were learned on a ranch in Southwest Saskatchewan. But I can certainly see it in just these early days of getting to know Joanne. It's absolutely true. Growing up on an acreage near Maple Creek, watching her parents, siblings, and friends and neighbors taught her so many lessons about the importance of commitment, passion, and doing what you love with people you love. It's these lessons that still inspire her in the work that she does every day. And you'll see that ring true in her presentation in this session. Joanne is honored to have been recognized by CDN magazine as one of the top 10 women in IT in Canada. She's also served on the board of directors for Saskatchewan Blue Cross, SaskTel, and the NSBA, which is Saskatoon's business association. Joanne spends her time across Western Canada in her role, working with WBM's customers and teams in Vancouver, Calgary, Regina, Saskatoon, and Winnipeg. So we're just thrilled to have Joanne. Our second panelist is Dr. Corey Newdorf. He's currently a professor with Community Health and Epidemiology at the College of Medicine, the University of Saskatchewan. Dr. Newdorf is the Medical Director of Health Surveillance and Reporting with the Saskatchewan Health Authority and professor in the Department of Community Health and Epidemiology at the University of Saskatchewan. He's received his medical degree from the University of Saskatchewan, a Master's of Health Science degree in Community Health and Epidemiology from the University of Toronto, and is a Fellow of the Royal College of Physicians and Surgeons of Canada with certification in the specialty of public health and preventive medicine. He's held various leadership roles in public health at the national level in Canada, and some of these roles include being chair of the Canadian Population Health Initiative Council, being president of the Canadian Public Health Association, and being president of the Public Health Physicians of Canada. He brings with him not only national, but international credentials and experience. He's currently serving on the editorial board of the Canadian Journal of Public Health and the Strategic Analytical Advisory Committee of the Canadian Institute for Health Information. He's president of the Urban Public Health Network of Canada and is a liaison member with the Regions for Health Network, that's World Health Organization Europe. His research interests include intervention research to improve health equity, health status indicators and surveys, and integrating population health into health system performance improvement and strategic planning. And I got to say, just a bit of further commercial for Corey, I'm a big, big fan. Third, love to, this really is a nicely rounded out group. We have with us Ron Stiles, who is a colleague executive in residence with JSGS. Because these are part-time gigs, Ron actually is also a consultant working with businesses and nonprofit corporations right across Western Canada, and I know Northern Canada as well. He served with the government of Saskatchewan in a variety of roles in both the Crown and executive sectors of government, including a long career in the public sector. Ron's been president of SaskTel. For 7 years, he was president, retiring in June of 2017. And prior to that, he served as the president of the Crown Investment Corporation for 5 years, Deputy Minister of Finance for 5 years, Deputy Minister of Highways, President of Sask Housing, and the President of Sask Water. Really impressive. During his time in government, he worked on a number of significant restructuring initiatives, including the last major corporate tax restructuring, the federal provincial territorial housing agreement that devolved social housing to the provinces, SaskTel's continued shift to an internet company based on fiber optics and emerging wireless technologies, as well as the sale of the province's financial interest in the Sask Furco fertilizer plant and the Regina oil upgrader. So we're looking forward to a very interesting and engaging discussion, and I'm pleased to turn turn the floor over to our first speaker. So Joanne, welcome.
Thank you very much. Just want to share my screen here and get the presentation started. So hi, everyone. Having a plan to restart the economy and move into the next phase of our economic recovery is certainly a really hot topic right now. And while we might not all agree on exactly how we're going to do it, I think we can all agree that there's a lot at stake in getting this right. So today's discussion is a really important one. And my challenge is to ask you to think about recovery in a new way today. I want you to think about what we need to build to move forward, not about how we go back to the way that it was. And I've been honored to be invited to be part of this discussion. And when Ron called me, I really had to ask myself, you know, what do I have to contribute here? And what I decided was the best way is just simply to share with you some insights from our business and our community, and really our own perspective as a privately owned Western Canadian company. We employ over 350 professionals. And we've been impacted by COVID-19. We've laid off 16% of our workforce. And I hope that our experience and my thoughts on how we go forward together is helpful and perhaps can enlighten you with a new perspective. I don't have any charts or graphs or stats or anything like that, but as we live through this, I do have some stories that I want to share about what we're doing, how we're going through this, and thoughts and ideas about the strategy that we're undertaking as we build forward. So I want to start by saying that I know that we all want a plan. We want phases and milestones and checkpoints, and I know that all of those things are really important. But I'd like to share with you 3 simpler things that I believe make us stronger even in times of crisis. So these are also things that I know that we have in spades here in the prairies. I'm just going to advance my slide here. There we go. So the first one is a leadership mindset. So this is about really a state of mind versus a set of plans. And what we've been seeing since mid-March, when the pandemic was officially declared, is organizations that are reacting. So forget about the 3-year business plan, forget about the quarterly plan. The planning for so many organizations, including our own, really became laser focused on each day that was in front of us. And in some cases, we even had the morning plan and the afternoon plan because things were changing really fast. And it might have felt like reacting to the here and now really meant taking those other plans that we had for our businesses and setting them to the side. The focus up to this point has been on how to safely keep going while keeping as many jobs as we can, serving our customers, and generating enough cash to sustain our operations. So the plans can change, but the mindset needs to stay consistent. And one of the ways that we study and build this mindset is through the teaching of others. So in particular, this book by Sean Achor. And, you know, there's many principles. I'm sure lots of you have read the book, and there's many principles involved. But to make my point today, I'm going to touch on just a few. And the first one is this idea that we can change our minds. There are many ways to fuel an economic recovery, and how we choose to look at it is really, really important. But don't worry, I'm not here to give you a talk about positive thinking as the way to an economic recovery. But I do want to explore this concept, and it's about the Tetris Effect. So basically the concept here is that we can train our brain to see patterns. And if you focus on the patterns of what's wrong, you're always focused on what's missing. And even if you fix all of those things that are wrong and get back all of the things that are missing, you're only ever going to get back to where you were before. And in our case, the way things used to be. But if we start to see the patterns of what's working and what's working right now, we can apply them to more and more situations, and we can get to places that didn't previously exist. So we need to look for patterns of success. And right now, in the midst of all of this, I feel that there's a real need to look for what's working to help us understand how the economy is going to build forward. So I'm sure some of you have been to a few of these lately, and this is a screenshot from an actual meeting that we had a few Fridays ago. Can't venture out, so we're going to have a virtual cocktail party. And you know what? It was fun. So along the bottom of the screen, you can see me. There's lots of our team members there. But here's the thing, is that because we have no other choice other than to do this, we come together in a new way. We see interesting things. We've got people here from Calgary, from Vancouver, from Winnipeg, Regina, and Saskatoon. And we weren't able to do this before. So this is something that's actually turning out to be pretty great, in that we can use new ways to stay connected and to move forward. And some of these things may even endure when all of this is over. We're finding new ways to move forward. And when we train ourselves to look for moments like that, things that are patterns of success, what we find at WBM is that we can apply that to our own business. So this is our strategic framework for building our business that we call Turning the Flywheel. And it's really about a mindset of focus, growth, and momentum. Many brands have their own flywheel. This is WBM's. And it can be a really, really powerful force in times like this. You know, our flywheel says that we have great client relationships. That's going to lead to more solutions, which are going to drive innovations, create wow factor results, and customer heroes that can then help by sharing their stories for us to create more great client relationships. But how do we do that? We create forums for our customers to create those stories and share those stories. So forums like Connection, and some of you on this call may have been to this event. Connection 2020 happened on January 28th. It was only a few weeks ago, but I can tell you it feels like a world away right now. 700 people together in one room. This is how we bring our community together. And when we're in a situation like we're in right now with COVID-19, because we can't all be together, this is a massive blow to the strategy of our business. But there are lots of ways for us to share our stories. And I'm sure that the wheels are already turning for lots of you in thinking about digital marketing and new ways in which you might reach your customers and share your own stories. There's the role of social media. And of course, you know, there are lots of things that can be undertaken as a different approach to connecting with your customers. But one of the heroes from that day is this guy right in the middle. So this is Jamal, and he is the head of IT for Saskatchewan Blue Cross. So here he is on the stage, January 28th, with Kevin Piesker, who's the president of Microsoft Canada, and he's telling a story. He's telling a story about a transformation that their organization undertook to move to Office 365, new platform that allowed remote work, collaboration, and secure access to information from end users anywhere. And who knew on January 28th how critical that success story was about to become? This was a wow factor result that led to new growth and opportunity for us in a time of crisis. And this story moves from a crowd of colleagues in a crowded room to now being shared across social and digital media. It's connected us to more businesses across the West that need the same type of transformation. So we never predicted these circumstances, but we believe in the power of a mindset that can help us navigate our way through this to the next challenge ahead in a positive and really constructive way. So the second concept is the idea of having strong values to guide us as we move through the next stages to an economic recovery. The values that built us, that got us here, can be the same, even if how we need to execute our business becomes a little bit different. So this is the WBM Values Tree, and I'm sure many of you have something very similar to this in your organizations. So we always said that we wanted to have values that define us to be more than a poster on the wall. And even though this is actually a poster on our wall, it's more important than what we ever thought when it comes to economics and when it comes to profitability. So in fact, it's these very same values that can bring us together in moments like this. This isn't a moment where we need to walk away from those values and make different sets of decisions. In fact, we can embrace them, and this can underscore the power of those client relationships and how we build forward. So in this way, these stories kind of go beyond a billable line item for us or a new service that we're creating, and they become personal and in lots of ways unforgettable. So I want to share a couple of these stories. For us, these stories are really, I mean, they're just a shadow of some of the incredible acts of heroism and selflessness that we're seeing throughout the pandemic, but they are meaningful to us. And when Shared Health Manitoba needed technology rapidly to open remote testing sites, our team drove all weekend to get that required technology in place, from a call on a Friday afternoon to 8 o'clock Monday morning, 1,400 kilometers driven over the weekend, and they wanted to do it. And this was something that wouldn't have been done before the pandemic. Here's another image. This is our build room, and a new world of technology support services. What used to be a technical process of us applying images to new devices, it now includes safety measures like sanitation, packing things in totes, contactless deployment. And it's also the story of readiness, because the computers that you're seeing there are owned by Farm Credit Canada, one of our clients, who purchased the inventory as part of their business continuity plan. Now, when they drafted that business continuity plan, they were thinking of types of crisis scenarios that would require them to work from home, maybe a tornado, maybe a flood, but it turns out that it was a pandemic that triggered their need for this on-demand inventory housed right here in the province of Saskatchewan. But here's the thing, these devices are not being deployed to Farm Credit Canada. They're actually, that team at FCC donated them to eHealth Saskatchewan to help in the frontline work that was going on. So we see some inspiration happening also in BC. This is Rob, who's wearing a 3D face mask that we printed in our facility. And we don't have enough capacity to really take on the shortage of PPE that's happening across the country, but we can help on a person-by-person basis. And this is an example of a member of our team seeing health records staff at the PHSA who didn't have the PPE that they needed when they were going into clinical environments, and doing what we can to provide that supply to them. So these are the values that connect us, and they shine even more in times of need. And they're going to stay with us as we move through recovery. Foundational element number 3 is really the power of technology to enable and connect us. So basically, you know, when we think about this one, it's not like technology is new. The power of technology has been available for us to turn on for a long time. And this is a really important one when we think about the economy. When we have a landscape here of privacy concerns, of data breaches, fear of AI and cybercrime, we now have some evidence as to how powerful technology can be, not to replace us, but actually to connect us and to empower us and help us be better together. This technology isn't a distant concept anymore. And it's not only for global powerhouses to afford, it's here, it's at our fingertips, from students to small businesses. And we can meet, we can co-create, we can present ideas, build strategies, and execute them all from different corners of the globe in a new way, in many ways because of this crisis. So when we think about the power and potential of technology, this isn't news, and organizations have been using it for a long time. There's organizations like Blue Cross, who have recently adopted it. And there are countless organizations who are planning on it. They had a roadmap. They were going to do it as part of their digital transformation. But one of the few gifts that this crisis has provided to us is that it's forced a move from things that are planned to now. The roadblocks are removed. They're out of the way. The reason to hold back, there are no more reasons to hold back. Organizations are moving forward with initiatives at a different pace. And that's making us better. It's making us more competitive, it's making us more connected, and it's making us more profitable. And here's an example of one such client who was already on a digital transformation when the pandemic forced us into high gear. And literally overnight, you can see where they accelerated from a few dozen to a few thousand remote employees, secure, connected, and productive. This is an article in the Star Phoenix that you may have read recently. The results are sweeping. This is an article talking about our public sector moving to adopt these platforms to be able to continue working. And all told, the WBM team across Western Canada has migrated over 23,500 end users to secure remote work platforms. And now, as our flywheel turns, we have to keep that mindset to find innovative new ways to deliver the support that's required. So what was a walk-up genius bar to support end users at SaskPower is now reimagined as a virtual tech express. So this is a remote system that allows someone to get support that they need with a simple click, joining a live team call, where there's multiple friendly faces waiting for them to help them get the answer they need when they're getting ready for a big meeting or when they're racing against a deadline for a report. This is all happening remotely. And the power of technology is enabling us to provide a friendly and personal experience from a customer that we can no longer go and sit at the desk with, but we're still able to deliver this to them remotely as they work from home. So now if we think forward, this approach can continue. And just imagine being able to get that level of support from a hotel room or an airport as we all start to work in different ways. And when you put it all together, mindset, values, and technology, you start to get these moments that the world is seeing for the first time. So this is Scott, one of our team members, working from home. And in many ways, you start to feel like we're going to remember these moments forever, and that these are things that we can build around, these new ways that we're working. This is Aaron, one of our support analysts in Calgary. You can see he's set up working from home in his garage. He's playing the guitar for his customers over the phone as he's delivering support. And these are things that weren't happening before, but they're possible now with the right mindset, the right values, and the right technology to support us. So when we think about the road ahead, what we're really thinking about, and what I want to encourage everybody on this call to think about, is building, about looking forward. And very specifically, it's a different mindset that moves us forward than the mindset that tries to return or tries to rebuild. So we're not interested in returning. We're not trying to rebuild or to create a new normal. When we think about innovation, the tendency is to think about a product innovation. So something new that's being created, a new algorithm or a new invention of some sort. And these things, of course, are innovation, but there's many types of innovation, and most of them come from new approaches and new processes. So the Model T wasn't an innovation because it was the invention of a car. It was the invention of a way to make a car so that everybody could have access to one. So as we move the economy forward together, I believe that we have to focus on people-centered process innovations, the experience, as well as the profit model, the offering, all the way across the spectrum. When laid-off workers return, their jobs are going to be different. We have to think about safety. We have to think about how we do the work. And what the market needs is going to transform the goods and services that we provide. Businesses in every sector are thinking about new ways. Transformations in how they're working and what they're doing are occurring all around us. But make no mistake, I mean, this is a picture of our team across Western Canada doing all kinds of fun things. And this is not about a cold new world where suddenly we're all working remotely and we never have the opportunity to be together again. We want this back so much. These moments being together, this is who we really are. And we will get there, but we have to get there safely and we have to get there all together. I'm not interested in a trade-off. And when I look at this slide, I need all of the faces on this slide to come back, not just some of them. So in closing, I really wanted to share a thought that maybe you really didn't expect to hear when you joined this webinar today. I know that I'm here representing the economic part of the recovery and the business side of this discussion. And that is so important to all of us, but we can think differently about our future. Economy, social, and health factors, they don't have to be competing forces. The reason this conversation is relevant is only because we are doing so well that we can start talking about getting back, because without health, there can be no economic recovery. And if there was, would it even really matter? We don't see this as a race. It's not about who can be the fastest. It's about being healthy and it's about being safe. And when we have that, everything matters again. A decision to go too fast has implications that we can never take back. And I hope that I've been able to show that we see the power of alignment between social, health, and economic interests. This is the path forward, not back, but it's also the way through this. And the changes that are happening today, and we can see them all around us because we had to make them, these changes can and should form the foundation for our framework for the future. So thank you for listening, and I'll turn things back over to our host.
Thank you so much, Joanne. Really appreciate your words, covering off and speaking to mindset, values, technology, and a future which isn't set in stone, but rather informed by a set of principles and values that are customer-centered and move us forward. So with that, I'm going to turn to Corey Newdorf. Dr. Newdorf.
Thanks. Just while the slides are getting up, I thought I'd just point out, I'll be talking about the health sector perspectives and health sector in a very broad circumstance, health and well-being really, on the economic recovery. And I have wake in brackets, wakes of COVID-19, because I think it's pretty well established now that most people are looking at this as a series of waves that are going to hit us. And how do we respond to that in a way that doesn't further cripple the economy by having surges of economic recovery followed by repeat stringent clampdown of activity, which could be lethal. So finding that new normal. So we'll start with the first slide. Okay. So first of all, I think we have to keep in mind, I keep hearing words like unprecedented and something we've never faced before. And the reality is, as a human race, we've faced pandemics many, many, many times in the past. And we can maybe say in recent memory, and certainly things have changed since the last time we've had a pandemic. But if you look at some of the historical documents from 1918 or previous pandemics and see the response and that the public had to those and how the restrictions that had to be put in place followed by the recovery and innovations that occurred in the wake of those, this is just the most recent in a string. And I think resilience of the human population is a learning. The other thing I keep hearing is initially that it's hard to predict or difficult to plan. Things had to happen last minute. And the reality is pandemic plans specifically have been in development and have been refined in the modern era for the last 35 years. And we've had multiple opportunities to learn from smaller pandemics and improve them. And that's partly why I think we've been able to respond the way we have, not just in Canada, but globally through the WHO. So as we look at the impact, there's a tried and true methods of dealing with these and dealing with them well. Um, and there's also quite a bit of learnings on how to then reopen that we're trying to draw upon. So the health system as a part of that economic system also has to look at phasing in or reopening. And I just listed some examples here of things that are in the works and have been planned for over the last number of weeks and ramping up now. So gradual reopening of certain types of elective surgeries and diagnostic testing, ambulatory services and primary health care that really is the type of health services that the vast majority of us tend to use on a regular basis. That tip of the iceberg in acute care or even getting down into emergency and ICU care is a very, very small percentage of the health system. But as such, that's the part that there was least number of beds for, and that's the part that can become overcapacity very quickly, as we've seen in other countries. So being careful to make sure that we reopen up the types of essential services that are needed for people to maintain their health or to stop from decompensating in their chronic diseases without reigniting cases that lead to overwhelming of the system is the tightrope that is being walked. But I think it's not just about reopening, as the last speaker was talking to us about. It's what have we learned from how we can deliver things safely in all kinds of sectors and institutions and now apply them to new types of businesses or services. So we've seen what can happen in spread of a pandemic in a waiting room environment or large crowds and social gatherings. Well, we've been talking in healthcare about eliminating the waiting room for a long, long time already. So how do we make adaptations to the way we're bringing clients in that is more respectful of the clients and their valuable time, as well as helping with infection control by adapting or eliminating waiting rooms? What about the pre-screening that we're doing both of staff and patients around making sure that if people are symptomatic with respiratory illness that they're not coming into those appointments or mixing with patients who are not. Again, that's just common sense in terms of infection control and are things that we've used in multiple outbreaks in the past. Prioritizing testing and using testing before someone comes into an elective surgery perhaps, or even periodic screening of healthcare workers through testing. Much more liberal use of personal protective equipment in lots of settings, everything from the barista that's serving you coffee right through to somebody who's providing a health service for you. There's going to be much more liberal use of PPE. And documentation to facilitate contact tracing. It's very difficult to try to remember for yourself, who is it that I've had close contact with in the last number of days or weeks. And we're asking the public as we gradually reopen to try and remember to keep physical distancing, not to congregate in groups, but where that has happened, we need you to remember, because if it happens that you become positive, we're going to be asking you to list those contacts so we can get in touch with them and minimize spread. Technology can help with that. We've heard about contact tracing apps that can help jog people's memories about where they were, but that's a change in mindset that's needed. The other big change that's happened is an enhancement to our epidemiologic surveillance, not just surveillance of the disease. Like right now, you're hearing all kinds of numbers about numbers of new cases, numbers of tests done, numbers of hospitalizations and deaths, and then converting those to rates. But what we need now is surveillance of the impacts of the reopen strategy. So as we gradually make these tentative steps and try to do them safely, we're bound to make a few stumbles and make some mistakes. We start getting more trade happening with places that might have more active cases. How do we make sure that we're testing in such a way that we pick those up early and we build in new triggers for when we might have to do a pause on moving forward to the next phase, or hopefully not steps back into more restrictions. But if we do that, can it be smarter and in a more concentrated geographic area, for example? So there's whole teams working on developing new indicators to look at what those triggers might be and how we make those decisions. You may have heard about the latest indicator, the RT number, or what's a basic reproductive number and an effective reproductive number. What it's essentially saying is, by keeping on with these measures to reduce the numbers of people we come into close contact with, even if you do become positive, there's less of a likelihood that you'll be spreading it to others. Left to its own devices, this particular virus has a reproductive number of between 2 and 3, which means the average person would spread it to 2 or 3 others. And you can see how that leads to exponential growth in an outbreak. But through the methods that we've enacted to date in this physical distancing and decreasing of social gatherings, etc., hand washing, hand hygiene, we've reduced that down to 0.7, which means every new case is actually not resulting even in enough to replace itself. And that's why we've seen numbers going down. So we're going to have an indicator where that's calculated on an ongoing basis and help us to see if we're hitting above 1. We need to be paying attention to a different way of doing our reopening, either slowing down, scaling back, reminding people of what they have to do things safely. But also more information gathered from people about the circumstances in those few weeks prior to their illness, so we know better where is it that they picked up the disease. If we start seeing trends that it's in a certain type of activity or a certain type of business, that might mean we have to refine the reopening strategy to minimize risk for people in those areas. So that real-time data collection and monitoring has to be done with enhanced contact tracing and testing that's going to be happening. That all feeds into a lot of more complex modeling. You've heard a lot about models in terms of looking at preparing the health system to avoid overcapacity. Well, models are now being revised, very complex modeling, on the newest data that comes locally to see what the impacts are of our reopening strategy. And as we get real-time data on whether that is resulting in more cases or not, we can actually project out into the coming months what impact that might have on later cases and try to course correct with the best data possible. And that allows us then to customize actions, not just at the provincial gross level, but at sub-provincial levels going forward. And then lastly, all of this needs to be balanced with the impacts on the most vulnerable. Certainly we can make broad sweeping policies and then find out that inadvertently those policies might have more negative impact on one subgroup than another. That applies to reductions in services that might be very essential for a subcomponent of, say, mental health and addiction clients or the homeless, that all of a sudden they've been left without a safety net that they were relying on. It can also put them at higher risk for complications of COVID, but it also can have collateral damage in terms of worsening chronic diseases or mental health and addiction problems, and cause excess mortality in non-COVID areas as well. So it's that balance that we're always looking at as we make changes to the system to have an equity lens on any of our activities. Next slide. So there's also a look at the behaviors. I've talked a little bit about this already. I think, again, feeding from the last speaker, things like thoughtful physical distancing now, just being more mindful of the fact that we come into lots of contact with lots of people on a daily basis. Are all of those necessary, and how can they be done more safely? More attention to hand hygiene, introducing the ankle bump or the or the elbow bump instead of a handshake, that might be something that goes forward for a long time, even as we are allowed to get back together. Things that people have become used to that are actually very convenient, and customer service related to things like curbside pickup and delivery, and setting aside certain exclusive shopping times for the most vulnerable. Those are things that clients have responded to very positively and may have widespread impact into the foreseeable future, even past COVID. And of course, large group gatherings, as was mentioned, the conference venue or many of the social gatherings where we are finding ways that, when necessary, can be just as effective. And some of those might lead to long-lasting changes in the way we do business. Next slide. We're also looking at then changes that might be introduced, not just in the REAMP plan, but more long-term. I think we're learning from this, despite various cycles, when things go badly and people understand that the prevention or public health side of the health system was under-resourced, as in the post-SARS time, for example, with the Naylor report, all of a sudden you get some reinvestment in public health, so this doesn't happen again. And then it can be 3-4 years later, our memory shifts, and all of a sudden those long-term, more preventive services get cut back because of the tyranny of the urgent. And I think we need to make some legislative changes that don't allow that to happen. Quite frankly, we need to have a more consistent base of surge capacity to deal with these kinds of concerns in our modern world, and to understand that actually investments in prevention and public health have long-term payoffs anyway. So using the investment in public health between crises to be doing more prevention and promotion work, but then you have surge capacity during a crisis to redeploy into managing a pandemic, is something that's been called for a long time. Things like virtual care, all of a sudden things that have been asked for over a decade already, on having billing codes and investment in the technology to do virtual care, all of a sudden the floodgates were opened, and we've seen that happen, and we're learning what works well and what doesn't in virtual care, and that can continue on. I mentioned already getting rid of waiting rooms. There's lots of reasons to do that. The pandemic is just one of the most recent ones that's brought it to the top of the list. Considering health equity now in all aspects of the health system. We're looking at the inequitable impacts of the pandemic, but quite frankly, it's just good business to look at health equity considerations in all aspects of our health system. The emphasis on staff safety and infection control and things like staff cohorting. Virtually every facility outbreak we've had, the recommendation from infection control is to invest in that monitoring and make sure that you're minimizing the amount of staff mixing across wards or facilities that goes on, because when an outbreak happens, that just leads it to grow very, very quickly. But then we get, part-time positions and people required to work in multiple facilities and wards, and it just happens again. So I think making sure we keep that as a standard where possible would help as well. And then of course, this has really shone a spotlight on existing living and working conditions in many parts of the health system, but especially in long-term care right now, and a lot of calls to look at what the job is like and the attention that we're paying to caring for our elderly and most vulnerable needs to change. Next slide. The social and economic changes, I think we've seen that COVID has exposed a lot of weak spots or design flaws in our current systems. We have some great social safety nets, but what's happened is it's like a patchwork quilt. It's every next change, we see a flaw or a gap, and so we tack on another part to the system to try and deal with that flaw. It causes a unintended effect somewhere else, so we put another patch on. And what we've seen in this immediate response to COVID is similarly a lot of social economic aid packages being crafted, announced almost daily. And these are all great, and it's seeing the resilience of government and of business. What's happened though is we're starting to see people who are afraid to go back to work unless the right safety precautions are there in their job conditions so that they're not put at risk, but maybe afraid to speak out because of precarious employment or job loss. Certain industries are more fragile than others. We've shown the weakness of just-in-time inventory when we're running out of PPE that's supplied by another country, or we don't have the right capacity to be able to scale up or have stockpiles in times of pandemic. And of course, the reliance of products from many, many different countries in a time of globalization. All of these things are being reconsidered. But I think it's also allowed us to see, again, the true role of government. It's not true necessarily that government should just have the smallest footprint possible. In fact, their role is to protect the health and well-being of citizens. And if they're not able to do that, they're actually not fulfilling their role. So we're seeing this increasingly complex and comprehensive transition funding announcements being put in place. But at what point do we say, should we rethink the role of a more generic approach then? Are we getting close to what should be a basic income guarantee? Not necessarily a universal basic income, but a basic income guarantee for those who need it that might well now be seen to be doable even past the COVID response. Those are the types of questions I'm hearing a lot of people start to ask now. The last slide, I think in summary, COVID is forcing people from a lot of different sectors to think what's possible. Things that were considered impossible before, all of a sudden we could do very quickly. And it's led to a surge in innovation that we just heard about. I'm thinking this could result in a change in people's acceptance of the status quo and even their perception of what really is a barrier to making program and policy change. So we've seen these examples already in the previous presentation on working from home, the need for office space. Do we really need as much? The safety and availability of mass transit and maybe needing more frequency so it's not so packed all the time when people go on, especially in large cities. Convenience of online shopping, curbside pickup, delivery is just ramped up even beyond what it was. We've talked about job working conditions and pay and the possibility of job retraining as whole industries go through huge upheaval like air travel, oil and gas, manufacturing, etc. Those are the types of transitions that often need government intervention and things like a basic income guarantee to allow that transition as industry transitions to a new normal into the future. So I think all of this in summary just highlights the need for all of government approaches and cross-sector planning, similar to what the last speaker talked about in their final comments, that this needs to be done collaboratively with industry as a way just of moving forward and planning. That needs to take center stage. Thank you.
Thank you, Corey. I really appreciate your comments, and I think the emphasis on populations that are vulnerable, talking about also the impact of something over time. So we can have a service, for instance, a health service that's considered non-essential on day one, that over time, because of vulnerability of populations and the need to return some service, some support, that they become essential as the months, weeks, and months go on. Your discussion about supply chain also, so very, very helpful in terms of presentation. And I'm going to turn now to Ron, who's going to give us great insight from a wealth of experience, not only as an economist, but as a CEO and as a leading consultant and executive in residence. So Ron. We just need you off mute, Ron.
There we go. Thanks very much, Dan. I'm looking forward to hearing some of the questions after we're done. And so with that in mind, I'm going to try to maybe tighten things up a little bit and get us to that point where we can get into a Q&A session. I would say as maybe a starting point, there's really no previous event in the context of our present economy and the way it's integrated that's had the depth and the breadth of impact that the pandemic has had on us in just a few months. So this is really a pretty unique situation. Whether you talk about the 2007-8 financial crisis, the 1987 black market crash, okay, the 2001 terrorist attack in New York, these all had impacts, but the impacts were generally pretty geographic or sector specific. And it only took a small period of time for the economy, in a sense, to recover and to come back. So we're looking at something where there isn't a base of information to really begin to measure and to understand what's going on. The big change for us from an economic perspective is globalization. We've got a lot more trade going on right now, and our global supply chains are all connected right around the world. And this means essentially that if you have an impact in one part of the world or one impact in terms of a sector of the economy, it's usually going to have collateral impacts throughout. Some of this is shown in the media on a day-to-day basis. And for instance, a news article this morning here in Saskatchewan talked about increase in the price for wheat and lentils. And this is all being driven by new demand at the home for these kind of products. So people are cooking at home, they need different products. All of a sudden the price of these specific agricultural commodities are going up. Conversely, potatoes are having a rough ride right now because a lot of the potatoes go to French fries. People are not eating in a restaurant. Therefore, demand is down, and you've actually got a significant problem for those that are trying to be potato farmers. These really reflect the kind of differential impacts that you're finding from sector to sector and from geographic area to geographic area. What is potentially good for us in terms of the shift in eating habits is not good for the people in PEI. And so it's important to recognize these types of differential impacts. Moving forward and starting to look at long-term recovery plans, I think government is going to have to do two things. First, and maybe foremost, they're going to have to start to have a look at the totality of impacts on the economy and more generally on our society, because there's going to be a lot of change that's going to happen throughout this pandemic that is going to be permanent. It is going to be long-term. The second part is what we're trying to recover to become. Joanne, I think, did a great job talking about this is a road we're on. This is it's not a loop. We're not going back to where we came from, and we need to take that into consideration. That means that changing consumer habits, the fiscal position of individuals and the government, the methods of business, perceptions of our safety and security, and many other aspects of our life need to be taken into account. And this is really an opportunity. It's not a negative in all ways, shape, and form. It is an opportunity to reposition things, to change our economy, to end up in a situation that maybe things will be better after than they were before. There'll be something positive coming out of this. On the next slide, in looking at some of what is going on in the world, it's always important to add some sort of a framework that allows you to consider what those impacts might look like. And one of the ways I've done this, or one of the ways I've looked at it, okay, is a traditional economics way, and that is looking at direct impacts, indirect impacts, and induced impacts. And if you don't start to consider some of those again, we're going to miss out on some fairly important lessons, okay, that are going to be taught to us through the way the economy interacts. Now, it has been difficult to find economic forecasts for Canada. The minute somebody publishes them, they're essentially going to be wrong. We have no idea what's going to happen almost on a month-to-month basis. So it's very, very difficult. But there has been 2 or 3 that have been published. RBC has probably taken the lead on this sort of process. They've actually issued 3 different forecasts over the past 3 months. So again, it just reflects how things have changed and how they're beginning to understand what the long-term economic impacts are going to be. If you have a quick look at what the economy is going to do in 2020, it's a 4.9% GDP contraction, at least that's what they're projecting, and a 3.4% rebound in 2021. And what's important about this is we will not get back to the same level of economic activity until 2022 that we had in 2019. That in and of itself tells you that there is substantial financial impacts, not just for government, for individuals as well. With respect to unemployment rates, they're saying by 2021, 7.6%, which is a full 2 percentage points higher than what we have in what we had in 2019. This is obviously a problem that's going to be there for students coming out of university, for high schools. This means that life decisions are going to be delayed for those that can't find jobs. This means that parents are going to have to support their children longer. There is quite a list of impacts that are going to come out of this. The overnight prime rate, they're saying, is going to stay at about 0.25% for 2020 and 2021. Not surprising in the sense of trying to provide a little bit more gas for the Canadian economy. But the larger problem is at 0.25%. I mean, this is great if you're going to go out and you're going to mortgage a house. But if you're heading into your retirement years, this isn't so great. This means that you're probably not going to get the returns you were planning on. It means a diminished stream of income or diminished lifestyle as you're moving forward. Now, the government financial situation is probably the other one that is most important, I think, for people to begin to recognize. Federal government debt in 1920 was $685 billion. The Parliamentary Budget Officer has made a projection that the increased debt from the pandemic is going to total $252 billion in 2020, 2021. This is a 37% increase in federal government debt in 1 year. We're piling on more debt in 1 year than we have in any decade in our history. Potential increase simply from the debt servicing costs are around $7 billion in 21-22. This is money that's going to have to come out of existing expenditure programs or from new taxes. Or you can continue to pile on the debt. But as we found out during the 1990s, it's not possible to debt finance things forever. Eventually, you're going to have to deal with it. Provincial deficits are just as bad. They're going to grow sixfold from 2019 to 2020 to $63 billion aggregated across Canada. When you look at a couple of the jurisdictions, Ontario and Newfoundland, their debt to GDP ratios, which is a ratio to give a bit of a sense of the financial liquidity, the financial situation in particular jurisdictions, it's going to go up by 19% in 1 year. This will put Newfoundland back to where it was potentially in the 1990s, and Ontario, it will bring them back to where they were in the mid-2000s, 2004, 2005, which means all the work they've done to dig themselves out of deficits from the past basically is going to be overwhelmed by what happens as a result of the pandemic. The next slide. Now, one of the places to start in thinking about recovery, obviously, is what's been done to date. And from my perspective, I think we've actually been lucky about the coordination of federal and provincial responses. It's been almost bereft of political action. Okay, it's really been about the health of the Canadian public, and then the economy was second. That debate around the balance between those two is now starting to heat up, and it's going to be a major consideration as we move into the medium term and the long term as well. The federal and provincial government both have been very fluid, very quick, very well focused in the responses as well. Having worked in government for a long time, to see them get a program up and operating and putting out a couple of $1 billion within 2 weeks, quite amazing. I mean, it tells you when people pull together exactly what can be accomplished and how important they view this to the well-being of our country. As everybody knows, the government of Saskatchewan has unveiled an initial recovery strategy. Now, there are criticisms of it, and they've already made some alterations to it. And, I think all of those are probably good things in the sense that something can always be made better. But I think we're very lucky from the perspective that it's important to start to restore confidence to the economy, to people here in Saskatchewan. And it's necessary to have some sort of a roadmap to see where you're going if you're going to get people to be a little bit more confident. And our government is actually stepping up, I think, and doing a very good job on this, which really leads me to sort of the last part of that is in the medium and the long term. And the next slide. It is going to be important for the Canadian government and the Saskatchewan government to consider these other impacts and begin to plan for them. We don't simply want them to slam into us over time. So I'm going to be a bit of a prognosticator, okay, and tell you where I think there's going to be some changes come to Canada and to our society. First off, I believe that in the next number of years, you're going to see increased taxes and reduced government expenditures. And this is at odds with some of the things that Corey, for instance, was talking about in terms of improving the health system and being prepared for pandemics. It's at odds with lots of other things that are going on right now here in Canada, the need for new capital investment for infrastructure, for instance, but yet you can't You cannot continue to borrow forever. You eventually have to deal with it. And this is going to be a reality, and government is going to have to change its mode one more time, just as it did through the 1990s. There's also going to be changes to our global supply chains. That trust or confidence, globalization that's been there for quite a period of time is already starting to break down. You saw a lot of different activities and events occur over the past 5, 6, 7 years. And I think this is just going to accelerate some of that. I believe as well that you're going to see Canada start to accent its North American security and trading relationships. We're going to have to make a choice as to our place in the world. And to a certain extent, I believe that our continued dependence on the United States is going to predicate that we're going to have to sort of take a step back and continue to work a little bit more closely. And this desire that we've had for an extended period of time to actually diversify our trading partnerships, I think you could probably see a bit of a reversal in that going forward. Another area is high savings rates. As people lose confidence in the economy, if they start to see the potential, okay, for their family to be left without food, clothes, without a home, roof over their head, for instance, I think you're going to see people start to increase their savings rates. And this means they're taken away from conspicuous consumption. They're taken away from consumption generally, and that means there's less business. And so this has a negative effect in terms of our economy. And I think it's one we're already starting to see. If you talk to some of the banks, the credit unions as an example, they're actually seeing deposit levels increasing right now in the middle of the pandemic. And that's because people are not spending their money on other things. They're not traveling to Hawaii or wherever else. You're also going to see reduced travel and tourism. I don't think there's any doubt about that. Unless we come up with a vaccine in the next year or next 2 years, people are going to really tone down their travel to a certain extent. That might be a boost for local tourism. There might be a positive out of this that we can take advantage of as an example. I also believe that demand for oil and gas is going to fall given the changes in consumer behavior that are going on right now. We've seen some of this as oil and gas demand has actually stabilized over time, but ever since the pandemic hit us, okay, again, travel is off, and that means oil and gas demand is usually going to fall. The long-term care system is going to be under pressure as well. When over 70% of the deaths that occurred in the pandemic and here in Canada is in long-term care homes, I think people are going to be reluctant to go back to long-term care homes, or at least to certain types of long-term care homes. This means that they're going to either have to change their approach, their orientation, or maybe you're going to look to different models. But there's definitely going to be some sort of pressure in that particular area. In addition, our post-secondary education systems are going to be under pressure from both an operational and a fiscal perspective. Operationally, they've started to demonstrate that you can do video presentations, you can do distance education, you can be very effective at it. Maybe not in all areas, but you can be effective in a lot of areas. This means that it's going to open them up to a lot more competition from other universities, both here in Canada and potentially overseas. But in addition to that, both the Saskatchewan universities, Saskatchewan up in Saskatoon and the Regina University, really depend on bringing international students in for a large part of their cash flow. That may start to drop to some extent just because of the pandemic. But in addition, if you can do something from a distance education perspective, they may make choices to stay in their own country and simply take distance education. So I think there's going to be some pressures there as well. With that, Dan, I'm going to stop there, okay, and let us get over to some questions and answers as well. But, you know, just to summarize a little bit here, it's going to be important to look at the depth of those impacts, okay? We're really doing it in a very surface manner right now. We need to start digging a little bit deeper and understanding sort of how these things relate to one another. Thanks, Dan.
Hey, Ron, I really appreciate the overview and to give us some very stark numbers, which are certainly out there. I'd like to thank Joanne, Cory, and Ron for your presentations. They're very insightful and helpful. We're going to open up the floor to audience Q&A. So thank you for those that may have already submitted your questions, but please submit any additional questions to Karen Jaster-LaForge via Zoom's chat function. So you'll see it usually on the bottom of your screen. If you could send Karen Jaster-LaForge your questions, I'll be sure to read them and direct them to the various presenters. So I'm going to take advantage of my moderator role. And some of you have touched on this, but just to have a little bit of fun. Some things are going to end in the future. Things that we thought would and were quite normal in January are likely to come to an end because of new way of doing things. Some may accelerate. In other words, we're doing them and we're hoping to expand them, but they've really accelerated. And other things will be new, things that we didn't even dream of. So I'm going to start just by giving you 3 quick examples. And maybe it's more hopeful than anything. First of all, what will end? I think buffets at restaurants are going to end. What do I see accelerating and has accelerated? Online appointments with doctors, and Corey mentioned this. And what do I think is new? For me, what's new coming out of this, I never dreamt I'd be meeting with my extended family via Zoom once a week. So while I'm isolated physically from them, I feel like socially, actually more connected. So I'm going to start, I'll put you on the spot, but start with Joanne, if we can, just really quick.
Sure. So sadly, I think what's going to come to an end is the business hug. I'm a big fan of the business hug, but I just don't know that that's going to continue. One of the things that's already accelerating in my life that I think is going to continue is this idea of shopping local, and it's awesome. I'm thinking in a totally new way about how I'm spending my money, how I'm connecting with local producers and local businesses. And then something that's going to be new, I think, is spending a lot of time in the car. You know, in my profession, in my work, I spend a lot of time on airplanes, and I can certainly see in my future that that's really going to shift to more time behind the steering wheel, driving versus flying. So that would be my 3 quick ones.
Thanks so much, Corey.
Yeah, I mentioned some of this already, but I think, you know, one of the things that's going to end is that casual physical contact with a handshake, or I know talking to some of my colleagues in Europe or Italy, they're bemoaning the double kiss on the cheek as the greeting, and rethinking what that needs to do. And I think that's part of just what a rethinking of what's necessary. The things that are going to increase, I think I generalize what you said, Dan, around the virtual appointments, and that's more about increasing connection, actually. I was quite surprised in the last few weeks, just by increasing that virtual care option, I was actually able to get a hold of my doctor quicker. I made a phone call about a virtual care, and within 15 minutes, I had a call back from my doctor and had my issue dealt with. And before that would have taken days. I think we're going to see lots of applications of this where virtual connection is going to mean we're seeing more people about more issues easier and connecting with groups on the fly. And that has all kinds of positive spin-offs. And I think that new normal is just that continual rethinking about, is this the way that things have to be done? Or is there another and a better way based on what our learnings are of going forward? It's a whole new way. You mentioned the connection with family. You know, we did a virtual Easter supper, and it was a lot of fun, actually. It's not that I want it to be replaced for that for all the time, but it's just, you know, increasing what's in our armament, I guess.
And thank you so much, Corey. And Ron, wanted to add to the challenge with the question I put forward by adding a question from Winter Fadak. For Ron, can you elaborate on your comment on changing supply chains? You mentioned changes over the last 5 years will accelerate. What are they, and why have they been changing? So just on that acceleration path.
Dan, let me start with some things that may not be with us in the future, okay? And one is, I think this is the death knell for the post office. Governments better have a close look, because they're going to start to see a real dramatic fall off, okay, in mail, more than they have already. Again, some things have to move, but they're tending to move by courier, not by post office. And so I think that's going to be one of those unknowns, I guess, that nobody really expected, but you know, it's going to hit us very hard. People now use Zoom. You know, grandparents use Zoom, children use Zoom. And again, it's not the only platform. There's obviously a lot of different platform teams, okay? You know, there's Cisco platforms, et cetera. But I just think it's becoming so easy that, you know, you're truly going to see this migration, okay, in a pretty major way by people that in the past would not have done it if they hadn't been pushed to see their children, to see their grandchildren, to, you know, it's a bit of an age thing it is, okay? So that's one of them. The second is the cruise industry is going to have to undergo a major overhaul. How that happens and what happens, I'm not sure, okay? But they already had problems around certain types of outbreaks on cruise ships in the past, and they've done a lot to try to deal with that. I mean, I've been on a few of them over time. But with this being added to it, I believe they're going to have to do a major restructuring, okay? And I'm not sure what that looks like exactly. Again, you know, maybe it is the large ships have half the people, okay, and there's more space allocated per individual, okay? But the industry is not going to survive if it stays with what it is, and I don't believe it'll stay in place at the overall size that the industry has at the present time. One other one I just touched on, okay, social isolation is going to become a bigger problem for us. A lot of the trends we're talking about simply means that, you know, people are going to be at home by themselves a lot more. Again, you know, we're moving to a lot more single parent families, single person families, et cetera. And that's going to be hard from a mental health perspective. And we're going to need to find new ways, I think, to connect people. You know, again, it's almost the opposite of going video, new ways for people to see each other, talk to each other in person. And so I think that's going to be another aspect of this that's going to be a problem going forward as well for the government. In terms of the supply chains, you know, there's been a couple of different trends over the past number of years that have been very important. That is, a lot of major companies, okay, in the developed world are now bringing certain types of services back to their home home country. Okay, you're seeing it in the United States, you're seeing it over in Europe, et cetera, and it's all about safety of supply lines. This idea that, you know, you can trust everybody is going to sort of run by the rule of law, et cetera, okay, it's just not accurate. And so you're seeing this occur, and I think you're going to see this occur faster. And part of the reason is that whether it's PPE, maybe it's food, you know, could be a whole variety of things. The whole idea of security policies for these types of products are going to come back into vogue. And again, they're starting to move in that direction as well. At one point in time, I mean, if you look at the agricultural sector over in Europe, as a result of World War II, they put in a set of policies that ensured agricultural products for Europe would be produced in Europe, not imported. Now, they were starting to get away from it. But again, I think you're going to see that stop. I think you're going to see even countries like the United States start to impose a lot more of this. The other big change that's going to have a major impact, I think, on supply chains going forward, you've already seen the US start to move to the use of tariffs. Yeah. I think you're going to see a lot more countries begin to move to the use of tariffs as well. And this whole idea of free trade on an international basis is probably going to die. You're going to have trading blocks, and within certain trading blocks, you might have free trade, but those trading blocks are going to be aligned with political ideology. They're going to be aligned with the type of economy you have. I mean, there's going to be other reasons for them, but it's not going to be a blanket economic policy. So that's a change that I see coming for supply chain, and people are going to have to try to adjust to it, or businesses are going to have to try to adjust to that.
Thank you, Ron. I've got two questions that go to Corey. We've got from Glenna a question on policy layering, especially in the area of our healthcare system, but in other areas also where policy layering retains outdated policy. It's kind of like if I'm getting this right, Glenna, it's kind of like the Band-Aid over top of policies that appear to be ineffective. So is COVID an opportunity to look at new policies completely? And we'll start with the health arena. And I said two-part because Doug Moen, our great leader, has asked a question. Out of the pandemic, elder care looks like it is in crisis, may have been there pre-pandemic. What are the key changes required to improve elder care going forward? So if we could kind of bring those two together, Corey?
Sure. I think from the point of view of the elder care issue, we've already started seeing this before the pandemic as well. A lot of people paying attention to the fact that staffing levels, the complexity of care increasing, and therefore the types of staff supports that were needed increasing. But yet the level of funding, the level of pay, the where those jobs fit on the pecking order in terms of healthcare personnel, it has not been commensurate. I think you could say it's almost the same on both extremes. We've had not as much valuing of the people who are providing care for children and for seniors in our society. And that's starting to show up now as schools have shut down for a while and parents are appreciating what teachers do, and daycare is shutting down, and with seniors now as well. And it's resulting on the elder side with really unacceptable death rates due to the pandemic. So I think there's going to be a relook at the institutional care that we have, more flexibility for spending that money where seniors best want to be, including whether you're paying people to stay in extended family and have the right kind of home care supports, whether you're having increased pay, staffing levels increasing, availability of personal protective equipment and infection control and inspections of facilities, things that I think have may have been sliding as we've tried to cut corners and inspection rates, and even privatizing a lot of places without the right kind of restrictions or guidelines in place. So yes, there's a link there to policy layering, because what we've seen is often broad-based decisions are made that then have an impact in multiple systems and institutions, and things like general cost containment, and you see inadvertent cuts in certain parts of the system based on a broad-based target to keep under budget. And the most vulnerable tend to be the areas where those cuts end up occurring, even though it's not by intention. I think what the pandemic is doing is showing where those weak spots are and where those collective cumulative decisions have resulted in an unsafe environment. And as I pointed out, the social safety net is another good example of that, where we've had various cuts and restructurings and then layering on of new programs. And at some point, the whole just doesn't make sense anymore. And there's a chance to relook at it from a fundamental perspective and say, is there a way to actually do more with the current resources, or even less, by simplifying and making something more safe and more effective, and not just think about the efficiency side.
Excellent. Thank you very much, Corey. Joanne, I'm going to ask you, this comes in from Andrew Stevens. The economy will open up before daycares and schools. What kind of financial support should we be offering parents who can't work remotely but are not able to find childcare? Should new forms of leave be introduced to ensure that these workers don't lose their jobs? And as a CEO, this has got to be something that I know occupies some of your thoughts and reflections. Joanne?
Absolutely. I think that on this topic, there's really, there's three structures that have to be in place here, and business definitely has a role to play in terms, I think, of in those cases when people can't work remotely. We need to be flexible with the types of work and the schedules that can be provided to our employees. And as businesses, you know, if we get creative and we get into that mindset of, you know, what is possible to work with the employee's schedule around where they can get childcare, or maybe when one spouse isn't working, or different scenarios, there is a role for business to play. And I don't think that we live in a country where we should be, where this should be an either or, where you can't secure childcare, so therefore you can't work. But if you are in a scenario in the short term, before there are enough childcare spots open or schools are back in place where you can't secure childcare, absolutely, I think leave should be available to you. You shouldn't be faced with losing your job, but I really think that business has a key role along with government to play here. And then the third element of that is, how can we actually get these childcare facilities back up and running in a safe way with the appropriate number of spots to really be able to support people going back to work. So I think that it's, you know, it's kind of a complex answer, and there's different roles for everyone, but I think business has a role to play in being creative and in creating those work scenarios that work with people's lives right now, because it is definitely a complex variety of situations that we're dealing with, and we need to be flexible and creative.
It's great. Thanks, Joanne. Now, Corey, it's quite a, you know, when we think of schools or daycare centers and congregating children, we think of vectors for disease. This COVID-19 and the way it's presenting in terms of risk to children is one thing, but the fact that they may be then the route or vector for contagion, is that a big concern, and how might we mitigate that?
Yeah, I think they're still coming to terms with that. The latest research coming out is showing that certainly it looks like children not only don't get this virus as easily as others and are not as symptomatic, but it also appears that they're not shedding the virus as much as some others in the past. So it might be that with this particular one, it's not as big a risk. That doesn't mean it's a zero risk, so we still have to pay attention to it. But that could be different for the next pandemic as well. As you mentioned, you know, certainly for H1N1, kids were a very important vector, in our strategy in Saskatchewan of immunizing that cohort first actually helped us end that pandemic a lot quicker than in some other areas. So I think it has to be looked at on a case-by-case basis. But as I said before, providing that kind of high quality, effective early childhood intervention and not just daycare per se is a priority that we should have had in the past anyway. So doing it safely now with the right types of supervisor to child ratios and the type of things that they do, and making sure proper infection control is being met, is this is just going to force us to do that.
For sure. Now, Ron, we have a number of questions that are coming your way. Do you envision the federal government giving individual industry, for instance, oil and gas or the airline sector, these individual industries that are badly affected by the pandemic, you see them being given financial support, bailout? And if yes, what would be the effects on the economy and government finance?
Well, they've already started that process of providing funding. There are really two categories of funding too. They've done some grants to some of the organizations, okay, to just provide them with essentially a bit of a bailout, okay. But they've also done some things around insolvency, making sure that they have the cash available to continue their operations. I think you're going to see more of that with both oil and gas and airlines. At least from what I can see, it's an absolute necessity. You know, these are very important to our economy, both are, and it's important to ensure that they continue to work their way through the pandemic, okay, and come out the other side and able to service the Canadian economy. I would make one note about this. There is a challenge in all of this, and that is that there's a normal turnover of businesses, okay, that start up, aren't successful, and they fail. And part of the challenge right now, I think, in what's going on, okay, is that we're having difficulty really trying to sort out which is which. Now, at this point in time, I think it's almost impossible. And so I think just giving, you know, money out very broadly, I think is the appropriate approach. But going forward, I think they're going to have to sharpen things a little bit. And that does come back to the whole question of government finances. If you put $100 million out there in loans to a series of businesses, you need to, you know, have the expectation some portion of that is probably going to be written off. And so, yeah, it does have an impact right away to the bottom line for government. It'll be interesting to see with something like the airlines, the approach that the government might take. Given the dollars we're talking about here, you know, several billion probably being lost over the next period of time with somebody like Air Canada, they have many different approaches they can take to this. I mean, they can provide the dollars up front, you know, give them the liquidity to continue to survive through the period, okay? Or they could allow them to go into some sort of an insolvency, bankrupt situation, okay, and let them restart. And this has been done a number of times in Canada. During the 1930s is a good example. A lot of the railway companies, that's the route they went. They became insolvent. The government bought them back. The government then provided enough of a bailout, okay, to sort of restart themselves. So it'd be interesting to see the mechanisms that are going to be in place going forward. But I think you can expect a fair number of these.
Thank you. We're rounding out at our hour and a half, and I want to express thanks to all three of our presenters. I'm going to have you leave off just with a very brief response to a final question, and that is, moving forward, as we incorporate these sound thoughts and experiences, is this going to be a health decision? Is this going to be a decision of business? Is this going to be a decision within the policymakers and the world of economics? What is that future that we're moving towards? What is it going to be decided by? And how best could we, or what advice would we give as a collective? So Joanne, do you want to kick off?
Sure. I don't know that I'm quite qualified for advice on this one, but I would say the number one thing that we can think of as we go forward is to be flexible. So this idea that we have a plan today that we believe in, backed by stats and science and all of those things, and that we implement it and things change, we have to be willing to be flexible and to be really, I think, responsive to new information as it becomes available versus being in a fixed mindset about how this is going to progress, because there are many, many unknowns. And I think that if we enter into it with a spirit of flexibility, then we'll be able to adjust on the new information as it comes to us. So that would be my comment in closing.
Yeah, I think this is underscored for us. If there was ever a situation that needed all of government approaches, a health in all policies approach, or evidence-informed policy making, this is it. And in order to do that, part of it needs extensive community and, I would say in this case, business sector consultation if you want success. So this has to be open and transparent, and making sure we're getting all those perspectives on the table, because we're going to get a better product out of the end if we've heard from everybody.
Thank you. Ron?
Based on the last 3 months, I'm hopeful that governments will continue to keep this as a non-political issue, continue to work together, continue to see that you have to balance both. It's not one or the other, at least I don't think it is going forward. The worst thing that could possibly occur, okay, is that in the upcoming federal election, maybe in 2021, et cetera, that this become a wedge issue, that it become one or the other. Because I don't think that reflects truthfully what people in Canada want right now. But so I'm hopeful they're going to continue to work together, and that they'll find a balanced approach, one that does the best that it can, okay, for Canadian people.
Well, if this panel is any indication of where things are headed, that new future, even though it may not be a new normal, it's a future. I think it's telling that we can have 3 people from very diverse backgrounds and areas. There is some crossover, but the beauty is that each of you have come in with a perspective. If we can develop approaches, remain flexible, be guided by principles, use of data, understand and be open to a changing and evolving world, that this is not something that humanity has never experienced. In fact, we have experienced, and we can overcome that. The resiliency will take us through it. I think we're in good form. Just in terms of the federal government and innovation, their innovation agenda, they speak a lot of super clusters and bringing university, academics, bringing business, bringing public policy to bear on tough questions. I think we've got one of the most significant super clusters that is forming naturally out of this work. And it's up to us then to innovate, using Joanne's words. So I want to thank you very much, everyone. If you could show, just by your show of hands, if you look at your reaction tab, you can clap on that tab. I'll just show you. Yeah, just as a show of thanks to our tremendous panel. And thank you for taking the time to join us. Make sure to watch for other scheduled events and to sign up and participate. What you're doing in participating makes it worthwhile for us to take our time to do this. So thank you so much, everyone. And I'll sign off.